We're now to speak a little bit more about South Africa's vaccination rollout program. We speak to Professor Linda-Gail Bekker, Director at Desmond Tutu HIV Centre. Very good evening to you, and thank you so much for speaking to us.
Thank you very much for having me, Zabetta.
If I could just get your point of view on the story that we have just been reporting to our audience of, that protest asking for better quality and access to life-saving COVID-19 medication. What are your thoughts on that? Are South Africans being denied that?
Yeah, well, I think we are living it again, and absolutely right. You know, those activists were correct. We have a deja vu to a couple of decades ago when we were fighting for antiretrovirals. It was exactly the same story, and some progress was made there where we have the patent pool, and early engagement happens with pharmaceuticals when new innovation comes along, where that kind of global good commodity is negotiated to be shared with particularly low and middle income countries, or countries that could potentially benefit. And we're reliving this now with COVID-19 vaccines, in that there is this extraordinary stark difference between countries that are accessing vaccines and countries like our own, where we are seemingly unable to easily access. So I think, this call is to see if we can even the playing fields a little bit.
And how do we do that? Is it as a result of the general inequity in the world, as you speak about? We know, obviously, that richer countries have stockpiled on vaccines, and the poorer countries are still waiting, still negotiating in a very difficult environment. Is it that, or is it that our own vaccine rollout program is slow to begin with?
It's all about access to vaccines. I think this country would be rolling out vaccines if they had them, right? So this is all about supply. And the truth is, there's been a bun fight for vaccines around the world. So those countries that could afford to put in orders early on and had the fortitude to do that, got on with it and got in the queue very early, and, as you say, stockpiled. What's happened is poorer countries have had to sit back and wait for their turn, and this is a ration commodity. There aren't enough vaccines for the 6-7 billion people in the world, and so we're dealing with a ration commodity, and we're having to stand in the queue, and patently, as I say, the differences between the haves and the have-nots is very stark at the moment.
Taking into account the laws of supply and demand, the political parties, opposition parties in South Africa have been very critical of government, saying that if you look at when the first batch of vaccines were received, the rollout was very slow for healthcare workers. And I think the concern is, if at this rate, not only are we waiting for supply, but if the rollout is slow, what are the chances that A, will receive herd immunity, but also in time?
So I want to defend what is being called the rollout at the moment. It is not. It is a preliminary to the rollout. So the rollout is not started. What we are dealing with at the moment is a phase 3B study being run by a fairly small network of researchers who've stepped into the breach to say, we had this gap. We haven't started our national vaccine rollout for lack of vaccines, and therefore, this is the kind of plan B, the contingent here, and because it's being run under the auspices of research, there are some limitations on how fast it can be done. Number one, the supply of the research vaccine doses, which are coming into the country in a very staggered way, compliments of J&J, but nevertheless, not coming as a huge consignment. We're waiting for the consignments. The minute they hit the country, we are distributing them and getting them into arms. So, we're on 170,000 healthcare workers in a month, and I think, considering it was a fairly small army of researchers getting this out, it's not bad. It is not yet the national rollout. We have yet to start that.
So,
and hopefully
Professor
that will be
Bekker,
happening soon.
Let's talk about that then, what is likely. I mean, the good news is we know that another vaccine, COVID-19 vaccine, has been approved. I think it's Pfizer, BioNTech's Comirnaty Vaccine. But for the man and the woman on the street, when can they expect to be vaccinated? Because we know that they are first priorities, first responders. But the general public, when is it likely? Could it be mid-year, end of the year?
So this is not my call. It is the government's call. My understanding is those Pfizer doses are coming. I don't know when. I'm as anxious to hear when they will be here. And then I understand that the minute we have finished with the patient-facing frontline healthcare workers, we move into phase 2, which starts to be the more general public. And then there are 3 phases. I understand the government has lined up with many more vaccine centers and the ability to scale up. So I'm hoping that once that moment happens, we will see many, many more vaccinations happening per day.
But just from where you sit, what are your predictions? Because we know that as much as government is expanding the number of vaccination sites, they have been criticized as being too few, and I suppose that's also as a matter of from whence you sit. But if I'm sitting at home and I'm worried about the winter months ahead of us, and there are these warnings of a third wave, if I'm to take comfort in being vaccinated, when do you think, from where you sit, it's likely to happen?
It all depends on when those vaccines hit the country. I think, we have the infrastructure to do it. It's just the availability of the vaccines. And I'm just grateful that we've been able to at least have an interim plan so we can get the healthcare workers, at least 500,000 of them done. But I agree with you. This is exactly the huge question. When can we get people vaccinated before the potential of a third wave? I think it's absolutely a critical question.
Thank you so much for speaking to us, Professor Linda-Gail Bekker, Director at Desmond Tutu HIV Centre.